Hey, Sheep.
Yeah.
Thank you so much for coming to the office today. My name is Dr. Sarah. It's very nice to meet you.
Nice to meet you too.
How are you feeling?
Pretty good so far.
Good. Well, thank you for coming in. I figured we would go ahead and jump right in. We do have quite a few things to go over today. So it looks like I have you scheduled for a cranial nerve exam with some neurological testing, just making sure everything is going okay. Okay, is this a follow-up to any sort of injury, or you're just making sure that everything's working okay?
I think everything's working okay.
Okay, perfect. All right, well, we can go ahead and get started. I do have just a couple questions to ask you, some patient verification, kind of normal things that we'll go over. I will ask you a couple questions neurologically just to make sure that everything is intact, and then we'll begin with a bit of a physical assessment.
Okay.
Okay. So I'll be taking a couple notes on my computer here, if that's okay with you. If I could just have you begin by confirming your name for me.
Just Sheep.
Perfect. And if you can just confirm your age.
30 years old.
30, perfect. I'm also 30. Welcome to the 30s club.
Thank you.
Of course. So as far as your overall well-being today, are you feeling generally well, generally unwell?
Generally well.
Generally well. Any specific concerns?
I don't know, sometimes sometimes I lose a little feeling in my scalp area.
Do you? Okay. How long has that been happening?
Maybe a year or two.
A year or two, okay. And have you seen a physician previously?
No.
No, okay. Is that secondary to any sort of injury, or you're just not quite sure what's causing it?
I don't know.
Okay, so unaware, so we will definitely look into that. And is that primarily on the scalp? Is there any like radiation anywhere as far as the face or neck?
I think mostly just on the scalp.
Mostly on the scalp, okay. Is it all over or more like isolated to a specific area?
A little bit all over.
All over, okay. So we'll definitely look into that. Okay. Just to ask you a couple questions about any possible symptoms, either related or unrelated. Are you in any pain today?
No.
No pain, okay. Good. Do you ever experience any like headaches or migraines?
Sometimes.
Sometimes. Do you take anything for that as far as like over-the-counter medication?
I guess like ibuprofen.
Ibuprofen. Does that tend to help?
Yeah.
Good, okay. How's your sleep typically? Do you feel like you're getting enough sleep?
I think I sleep maybe about 5 to 6 hours a night.
5 to 6 hours, okay, so a little bit shorter than average. Do you feel like that's adequate for you? Do you feel rested?
Yeah.
Okay. That's fine, everybody's different. I require a little bit more sleep. Some people require a little bit less. That's okay. All right. Okay. And then as far as any physical symptoms, aside from your head or neck, so any like aches or pains in your joints, shoulders, wrists, knees, anything like that?
Sometimes my back and knees.
Sometimes, okay. And is that just like typical age related or?
Probably.
Okay. We all have a few aches and pains every now and then. Okay. All right. Have you ever had any major surgeries? Okay, good. Are you currently taking any prescription medication?
No.
Good. And have you ever been diagnosed with like hypertension, high cholesterol, diabetes? Any family history of cancer?
No.
All right. Okay, and then lastly, for your physical symptoms, do you ever experience any like tingling or numbness in any of your extremities or your face?
No.
Good, okay. Okay, when was your last optometrist appointment?
Optometrist. It's been a while.
Been a little bit?
Yeah.
Okay, that's okay. Do you wear glasses or corrective lenses, contact lenses? Do you feel like your vision is okay without that?
Yeah.
Good. Have you ever been told that you were colorblind?
Mm-mm.
Okay. Have you ever been tested for color blindness?
No.
Okay, so I will probably test you for that today, as well as a brief eye exam as part of your optic nerve, cranial nerve exam, just to make sure that everything's functioning okay.
Okay.
Obviously, I'm not an optometrist, but I will refer you to someone if I feel like something is going wrong there, okay? Perfect. And then any pain like in your jaw with your teeth?
No.
Good. Do you see a dentist regularly or semi-regularly?
Yeah.
Okay, I think that is it as far as our preliminary assessment. Thank you so much. So let's go ahead and get started with a bit of a neurological exam. So essentially just testing to make sure that your cranial nerves are intact. So this is going to consist of two parts. The first part will be a verbal exam. I'll ask you a couple questions. I'll ask you to look at a couple pictures, read a few things, and then the second part is the physical exam where we'll kind of run through the cranial nerves. There are 12 of them. I do tend to group them together, so the cranial nerves for your eyes, for example, kind of vary, but I'll group them together. That way we're not switching back and forth. Okay? So I am just going to grab this, and we can go ahead and get started. So I'm going to start by just asking you a couple questions that are relevant to kind of society today, just to get an idea of your overall social awareness. Okay? So just answer to the best of your ability, no pressure.
Okay.
Okay, so can you name one relevant thing that's happening, like in the news recently? Anything that you are aware of, that you know about?
The election just happened.
The election, very good. Obviously very relevant. Okay. Good. And can you tell me where we are right now? Where are you?
I'm at the doctor's office.
Very good. Do you remember my name?
Dr. Sarah.
Very good. Okay. Can you tell me what color my jacket is?
White.
Perfect. All right, so your situational awareness is very well intact. If I could just have you tell me what month it is?
It's November.
It is November, very good. And what year?
2024.
Perfect. Okay, so alertness and orientation is all intact. You obviously know where we are and what's going on in the world. So that is very good. So we're going to move on to a bit of a stroke evaluation. Now, obviously, I don't think you're here today for a stroke, but this is just part of the cranial nerve exam. So I'm going to show you a couple different things. The first one is a scenario, essentially. So if I could have you look at this and just tell me if you notice one or two things that seems abnormal about the situation.
Oh, it's very dangerous.
Very, yes.
The stool is being knocked over and the water is running.
Very good. Can you tell me how many people you see in this picture?
3.
Very good. If I flip to the other side, I'm going to ask you to point to a couple objects here.
Okay.
So if you could point to 2 items that you could either lay or sit down on.
Okay. This one.
Very good. And can you tell me what this is called?
A hammock.
Good. Can you point to the object that you would use to open a door?
This.
Very good. And can you point to 2 objects that you would typically find outside?
And
Very good. Okay, good job. Seems like a bit of a trick question, but you did well. So for the next one, I'm going to have you just read a couple of simple phrases for me.
Okay.
So if I can have you read this very first sentence.
Okay. You know how.
Perfect. And this one here.
I got home from work.
Very good. And if I flip this over, if I can have you read this phonetically for me, so just letter by letter.
Okay. M-A-M-A.
And then if you can read this one backwards.
Okay. P-O-T-P-I-T.
Very good. And then you can just read this one as it is.
Okay. Baseball player.
Perfect. So no issues with that. You are clearly able to read adequately for your age, so that is very good. So we are negative for TIA, which obviously is very good news. Okay. So the next couple of questions are just very brief arithmetic, so just basic math.
Okay.
Okay. So if I can have you just verbally solve a couple equations for me.
Okay.
Can you tell me what 5 plus 5 is?
10.
Very good. And 10 times 2?
20.
20. Can you add 20 plus 10 together for me?
30.
30, very good. All right. So all of that seems to be intact. I would say that the neurological portion of your examination is totally fine, so there's nothing to worry about there, okay? So we're going to go ahead and move on if that's okay with you. So I will go ahead and set this aside. I'm going to pop on a pair of gloves and then we'll begin with the physical exam, okay? Okay. So I am just going to sanitize my hands. Okay. All right, so we're going to go ahead and get started, and I think I would like to start with just kind of a basic inspection of your overall posture, make sure that everything is going okay with that. So do you typically find that you slouch over regularly?
Yeah.
Okay. It is very hard to remember to sit up straight. Even I am not that good at it, so that's okay. So I'm just going to have a look at your overall posture, make sure that there's nothing, mostly looking for like wasting of your muscles or any atrophy from one side to the other. So just making sure that everything is fairly symmetrical. So of course, nobody is perfectly even from one side to the other, but just having a look there. That looks okay. I'm not noticing any, is it okay if I touch you here?
Yeah.
Okay, so I'm not noting any abnormalities in the shoulder alignment there. So I will have a look at your back when I come around.
Okay.
So if I can have you just set your hands flat on your lap for me.
Oh, on my lap, okay.
Perfect, okay. So just looking at the elbow alignment and correlation to the wrist and the knees, and all of that looks okay. Perfect. So any pain in your neck currently? All of that feels okay? Okay, good. So if I could just test your mobility briefly, are you able to lean your head all the way back for me? Perfect. And then if you can come as far forward as is comfortable for you. That looks good. And then if you can turn all the way towards the door. And then all the way over towards me. All of that looks great. Okay, perfect. Good. Okay, so let's go ahead and get started, and we might as well get the eye exam out of the way as it is kind of the most lengthy part of the examination. So I'm going to start with just a basic look at your eyes as a whole. The light is very bright, just to give you a warning. So you're welcome to kind of veer off in general. I wouldn't ask you to look directly at the light just yet, okay?
Okay.
So I'm just going to have a look. You do have very light eyes, so I will be cognizant of that because blue eyes tend to be more sensitive to the light itself. So just having a look at the overall color, not noticing any abnormal discoloration there. So sclera is clear. Very good. Just have a little tool here that I'll be popping on my finger, and this is going to allow me to gently just pull down on the eyelid.
Okay.
So I'll have you just look straight ahead for me. Very good. Just having a look at the sclera, looking for abnormal mucosa, which I'm not seeing. So I'm going to have you look down, and then I'll raise the eyelid up. Very good. Very clear eyes, no yellowing, and I don't see any abnormal veinage, so that's good. All right, so I am going to test your pupillary reflex. So essentially, your pupils should dilate and constrict both consecutively and independently. So I'm just going to be shining my light kind of in and out. You can just look straight ahead for me and just kind of allow yourself to blink as you would naturally. Okay? Okay, so I'm just going to start by shining here. So I do see appropriate constriction and dilation. Just performing a bit of a swinging light test here. Any sensitivity to the light there? Does that hurt at all?
Not really, no.
Okay, good. So I have a little card here. I'm just going to use this to occlude either side. So just have you look straight ahead for me. Just allows me to test your eyes independently and then together. So all of that looks good. Okay, so I am going to just have a look with my ophthalmoscope here. So I will be coming a little bit close to your face. I'm just going to have a look at the back of your eye. So having a look at the optic disc and the nerve that lies just beneath the eye there, okay? So again, if I can have you look forward for me and excuse me as I just come in closer. Okay, so just following the optic disc there. And that looks perfect, okay. Same thing on this side. Very good. Okay. Nice and clear, which is a really good sign. Okay. So I have this little blue light here. It is a little bit hard to see. So what I'm going to do is have you follow this with your eyes if you can. Okay. So I'm going to move it around kind of sporadically. Just try to follow it if you're able to. So let's keep your head straight. Very good. Perfect. So you did really well with that. Any pain with the blue light itself?
No.
Okay, good. So I'm going to move on to testing your peripheral vision. So peripheral vision essentially is what you use to see. If you're looking straight, you should still be able to see out of the sides of your eye. Now we do have natural blind spots, so there are certain areas where you should no longer be able to see it. So I'm going to test this with the light and then with a different object. So I'm just going to place this on my finger. Now, same thing, I want you to look straight ahead for me, and then I want you to follow the light. This time you tell me when you no longer see it, and then when you see it again, okay? So for example, here, obviously you should be able to see it. If I move it here, it should leave your visual field.
No.
Okay, perfect. So we're just gonna test that in different regions here. So tell me when you can no longer see it.
No.
Good.
No.
Good.
No.
Perfect.
No.
Excuse me while I switch hands here.
No.
Good. And then I'm going to give you this occluder here. So you can choose to occlude whichever side you'd like to start with. It's just going to make it a little bit harder. There you go. So can you see this here?
Yeah.
Same thing. Tell me when you no longer see it.
No. No. No.
Perfect. So go ahead and switch eyes for me.
Okay. No. No.
Good.
No. No.
Very good. Okay, so you can see this here still. So go ahead and keep that there for me. Can you tell me what color this is?
Green.
Very good. So same thing. Can you see it here?
No.
Good. See it here?
It's gone.
Good.
No.
Can you see this one?
Yeah.
Okay.
No. No.
You see them both?
Yeah.
Good. So tell me when they both disappear.
Okay. No.
Good. Okay. I will take this. You did very well.
Thank you.
Okay. Now for these two here, can you tell me what the difference is?
One is lighter than the other.
Very good. And which one is darker?
This one.
Perfect. Okay. All right. You are doing really well. So we're going to shift our focus just a little bit. On the wall back there, I have a larger Snellen chart, but I'm going to go ahead and use the pocket chart today.
Okay.
So I'm going to hold this at about an arm's length here. Are you able to see this okay? Okay, so I'm going to point to the letters if I can just have you read them.
Okay.
So can you tell me what this is here?
E.
And if we skip down.
F. P. H.
Very good.
E. P. T. Z. O.
And can you read the lowest line at all?
L. T. F. P. H.
Perfect. Can you tell me what color this is?
Red.
And if I ask you which of these is smaller, this one here or this one here, which would you choose?
The one on the left.
This
That
one
way,
here?
yeah.
Very good. Okay. And then if I can just have you occlude one of your eyes with your hand for me.
Okay.
Are you still able to read that smallest line?
Yes. L. Good.
And if you can switch eyes for me. And then I'm going to ask you to read it backwards.
HPFTL.
Very good. Okay, so your visual acuity is definitely intact. You are able to see at about 20/20, so that's okay. So I am going to go ahead and test you for color deficiency.
Okay.
I know you said you have never been tested for this before, so it's a very simple test. These are Ishihara test plates. Now, to give you an example, the first one is kind of a control, so you should be able to see a number here.
Yeah, 12.
Very good. Now, these other ones are going to get a little more difficult as we go along.
Okay.
Do you see a number here?
29.
Good. And here?
74.
Very good.
745.
Perfect.
2 and 8.
Good. There's actually not a number there, but it does. It's a trick. It does trick you to think there is an 8, so that's okay.
Okay. 16 and a snake.
Perfect. Can I have you trace that from start to finish for me?
Okay.
Very good. Okay, you did really well. These next few are a little harder.
Okay. 35 and 96.
Very good. And this last one here, do you see anything?
There's 2 more squigglies.
If you can trace that for me one more time.
Okay. There's 2 lines. Do you? Okay.
Yep, so just do it all the way around if you
Okay.
can. Very good. So you are not colorblind. Good news.
Okay.
All right, so I'm just going to take a quick note of that here. So visual acuity 2020. Color deficiency is negative. Pupillary reflex are intact. All right, you are doing really well. So we're going to keep moving right along. Let's see the next thing that I think I want to go ahead and get out of the way. Why don't we do your ear exam? So I'm just going to pop this off and switch over to my otoscope so I can have a look inside your ears. Do you ever have any pain or abnormalities with your ears? Like,
I used to have a lot of ear infections.
okay. And that's healed up nicely?
Mm-hmm.
Okay. Any like drainage, earwax, bleeding of the ears?
No.
Okay. Do you swim frequently? Okay. So I'm just going to place this near your ear and I'll just have you look straight ahead for me. So the ear canal is fairly clear. I'm not seeing any abnormal colored earwax. Cerumen is honey colored, which is good. And tympanic membrane is pearly gray. Very good. So any pain in the ear at all?
Mm-mm.
No discomfort there? Okay. So coming on this side, same thing. Okay, so anatomy is intact, tympanic membrane is pearly gray, and again, earwax is not abnormal in color, so that's very good. Okay. Do you ever have any difficulty with your hearing, or does anybody ever tell you that they tend to repeat themselves because you can't hear them?
No.
Okay. So I'm going to do a brief hearing test. A couple different things to test here. So if it's all right with you, I'll have you close your eyes. I'm going to test a couple different things and you just let me know if and when you hear it to start with, okay?
Okay.
So for this first one, you're just going to hear this sound. So just say yes if you hear it, okay?
Mm-hmm. Yes. 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 Yes.
Perfect, okay. So now I'm going to test directional hearing. So I'd like you to tell me if you hear it on the left or right side, okay?
Okay. Right. Left. Right. Left. Left. Right.
Perfect, and if you can tell me whether this is moving closer to your ear or further away.
Closer. Farther.
Good.
Farther. Closer.
Very good. And then if you can tell me which side it's starting on and which side it's ending on.
Okay. Right to left. Left to right.
Very good. All right. So this time I'm going to be testing with a gentle puff of air. I'd like you to just tell me when you can hear it. They might also be below or above your head, okay?
Okay. Left. Right. Down. Down. Up.
Good.
Left. Left. Right.
Very good. Okay. You did really well with all of that. So the very last thing is I'm going to whisper a couple of words. I'd like you to attempt to repeat the words for me. Okay?
Mm-hmm.
So I'm just going to occlude this ear here.
Mm-hmm.
Basket.
Basket.
Willow.
Willow.
79.
79.
Very good. Cat.
Cat.
Poster.
Poster.
83.
83.
Very good. Okay, so your hearing is definitely intact. Very good news. And your ears look clear, so no abnormal earwax. When is the last time that you had an ear infection, do you know?
Maybe about 2-3 years ago.
Okay, so a couple years, but still semi-recently.
Mhm.
Was that like secondary to a sickness? Did you have the flu or anything, or was it just kind of
No,
random?
I think it's hereditary.
Is it? Okay.
Yeah.
So it can be definitely hereditary if your parents tend to be susceptible to ear infections, especially if you had them as a child. You're more likely to have recurring as an adult, so that's okay. All right. So let's go ahead and keep going. So I think the next thing I'm going to test is your nose and throat. So we'll have a look at your olfactory nerve, which controls your sense of smell. And then I will have just a quick peek in your mouth, make sure everything's okay, and then we'll go ahead and move on. Okay? So I'm going to start testing your nasal patency. So nasal patency essentially is just your ability to breathe equally through your nares. Do you ever have any issues with like seasonal allergies or asthma?
No.
No. Okay. So I'm going to occlude one side. I'd like you to just try to breathe in through the other nair. Good. Very clear. Very good. And if you can just breathe in through both. Good. And then if I occlude both, if you can breathe in and out of your mouth. Very good. Okay. So I'm going to do a brief test of your sense of smell. So I have 3 different things here. They are pretty common, I would say, at least things you would come into contact with on a weekly basis, so you should be familiar with them. If you can just attempt to smell them for me.
Okay.
So just to give you a heads up here, the color does not correspond to the smell necessarily.
Okay. Orange.
Very good. It's very strong. I smell it from here.
Citrus.
Good. So that one was lemon, or lemongrass, I should say.
Still kind of citrusy.
Okay. I could see that. This one is orchard apple, they say, but I could see why you would say citrus, so that's okay. Did really well with those. 2 out of 3 is considered passing, so that is okay. So we can go ahead and test your oral exam just a little bit. So no issues with your mouth, like canker sores, mouth sores, cold sores. Okay. Gums are all okay?
I think so, yeah.
Okay. So if you could smile for me with your teeth, and then with no teeth, stick out your tongue. Very good. Okay. Just gonna have a peek. And then if you can lift your tongue up to your hard palate there. Very good. Okay, and then I'll have you just rest with your mouth open for me for just a second. And say, ah. Very good. Okay, so uvula is midline. Very good. So we can go ahead and move on. So I think the next thing I would like to test is just a little bit of a neurological exam here. So I have a couple items that I will be placing in your hands. I would like you to try to identify them for me with your eyes closed. So again, everyday objects, you should be able to tell what they are.
Okay.
Okay. So go ahead and close your eyes for me. And here is your first object. So just hold your hand out. Perfect.
It's a battery.
It is a battery. Very good. Might be a little bit harder.
Oh, I know the word for this. Carabiner?
Yes, very good job. And this one here.
Clothespin.
Yes, that is a clothespin. And I just have two more. These two are similar in texture.
Oh, that's the safety pin.
Yes, very good. And last one there.
Paper clip?
Yep, very good. Good job. So in line with that test, I am going to mark either a number or a capital letter in your hand, and I'd like you to try to identify what it is.
Okay.
Okay. So if you just hold your hand out for me.
Should I have my eyes closed? I'm sorry.
Yes, that's
Okay,
okay. I should have specified.
That's
Yes,
okay.
please. So I'm going to start with a letter.
C.
Good. Again, a letter.
N.
Okay, we'll try one more time.
W.
That was a W. Good job. So this is a number.
8.
Very good. And again, a number.
9.
Good. So we'll try the other hand.
Okay.
Same thing.
I.
Okay.
D.
Very good. And a number.
7.
And a number.
3.
Perfect. Very good job. All right, so I'm going to come around, if that's okay. I'm going to assess your posture a little bit from the back, and then I'll kind of have a look. I know you said you were having some issues with your scalp, so we will do a bit of a sensory exam, and I'll have a look at that from there as well. Okay. All right, Sheep, so just having a look at your posture to start off with. I'm just going to look again at the shoulder alignment there, as well as your spine, having a look at any possible abnormalities there. Okay, good. So everything is fairly well aligned. I'm not noting any wasting from one side to the other. Is it okay if I move your hair off your neck?
Oh, go ahead.
Okay. Just having a look at the neck, the musculature here. Going to bring your shoulders back slightly there. Any pain there?
Oh, no.
Good. Okay. All right. So I'm going to do a couple tests, just some percussions while I'm back here.
Okay.
So I'm just going to be using my reflex hammer to tap in a couple of different places.
Okay.
I would like you to say 99 when you feel me tap on your back, okay?
99. 99. 99. 99. 99, 99, 99, 99, 99.
Good. Any pain with any of that?
No.
If I palpate along your spine, is there any pain here?
No.
Good. Okay. All right, so I'm just going to have a quick peek at your scalp. You have a very cool haircut.
Thank you.
You're welcome. So the scalp itself is very clear. I'm not noting any abnormal discoloration there.
Mm-hmm.
And you said the loss of sensation is kind of all over?
Mm-hmm.
Okay. So as I just touch you with my hands here, can you feel that I'm touching you?
A little bit.
A little bit, okay. So would you say that this sensation is less than here?
Yes.
Okay. And there's no pain associated with that at all?
Mm-mm.
Okay. So I'm going to test a couple of different things here and see if we can get a little bit of an idea of what might be going on.
Okay.
So if I start with a very soft sensation, so to give you an example, this here I would consider dull or soft. Can you feel that?
Yeah.
Okay. So I'm going to touch your scalp. I know I'm behind you, but if you can close your eyes for me and just attempt to tell me what, if anything, that you feel, okay?
Okay.
You feel that there?
Barely.
Barely, okay. Any more or less here?
A little more.
A little more, okay. And here?
Tiny bit.
Tiny bit, okay. Any difference on this side?
Nothing.
No, nothing there?
Mm-mm.
Feel it here?
Yeah.
Okay. In here?
No.
No. Okay. So I'm going to alternate here with this sensation versus this.
Mm-hmm.
Try to tell me if you can distinct between the two. So this would be soft or dull and this would be more sharp. If you can't tell which it is but you can feel something, just say yes. Okay.
Okay. Sharp.
Good.
Dull.
Good.
Sharp. Sharp.
Very good.
Dull.
Okay.
Sharp. Dull. Sharp. Sharp. Sharp.
Okay.
Dull.
Okay. So I'm going to try that with something else. Can you feel this here?
Yeah.
Does that feel the same as this?
Yeah.
Okay. And here, does that feel the same?
Yeah.
So if I move from your hairline back here, can you tell me at any point if this feels any different?
It's a little less.
Right here?
Yeah.
Is that the same on this side?
It's a little less.
A little less. Okay. Just going to palpate around and see if there's anything internal that could be obstructing your sensation here. So just feeling for any possible lumps in the head or any swelling that could be creating an abnormality here. Any pain in this area?
No.
Okay. So if I... Can you tell me at what point it starts to feel less?
About right there.
Right there. And coming from the back?
Right there.
Right there. Okay, so... Radial to the ear there. Same thing on this side. When does it start to feel less?
About there.
And from the back?
Right there.
Okay. Any less sensation on your neck, or does this feel about normal?
About normal.
This side, same thing?
Yeah.
Okay. So there's definitely some sensory loss here in this area, kind of midline to the ear, and it is bilateral on both sides, so that is very interesting. As far as the rest of your scalp, can you feel this okay?
A little bit, yeah.
Okay. And does that feel any more or less than this area?
About the same.
About the same. Back here, any more or less?
About the same.
About the same. Okay. I'm going to percuss around with my hammer here. Can you just let me know if any of this is painful? Do you feel any tenderness?
It's not painful.
Not painful, so that all feels okay.
No, it's not painful.
Okay. And nothing on the back of the neck here hurts.
Mm-mm.
Interesting. And nothing on the ears hurts as well.
No.
Okay. All right, so I'm going to come back around the front here. So I'm going to go ahead and test the sensory components of your face and see if that is related at all, or if there could be something going on with your scalp or head itself.
Okay.
So same thing, I'm going to kind of do a variation of tests on your face. So I'll start with the soft. If I can have you do something just a little more distinct here. Now before I touch the rest of your face, I'm going to quickly test your reaction in your eye. So if I can have you look forward for me. Very good. Very good. Okay, so equal reactivity there. So I'm going to touch your face with this soft cotton here. Can you feel that? Okay. So just close your eyes for me. Say yes if and when you feel something.
Okay. Yes. 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 Yes.
Good.
Yes.
Good. Okay. Now if I alternate between this here and this here, can you feel a difference? So this here versus this here, too similar? Let's see. Okay, so I'm going to do this versus this.
Okay.
And I want you to tell me whether or not you feel sharp or dull.
Okay. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Okay. So if I alternate now between 1 or 2 points, can you feel the difference there?
Mm-hmm.
Okay, so if you can indicate 1 or 2 for me.
Okay. 1. 2. 2. 2. 2. 1. 2. 1. 1. 2. 1. 1. 2. 2.
Good.
2.
Good. Can you feel that this is soft?
Mm-hmm.
Can you tell me if it feels any different this side compared to this side?
Kind of barely there, but
On both sides?
yeah, but on the same.
On the same, okay.
Yeah.
And here versus here?
Same.
Here and here.
Same. Same.
Any difference down the neck here?
Mm-mm.
Okay. Same thing. Does this feel the same?
Yeah, it is.
It does. Okay. And all here, does that feel the same?
Yeah.
Any difference along the jaw there?
Mm-mm.
Okay. So you can go ahead and open your eyes. There were a couple differences. Certain areas, specifically around the chin, that you were not able to feel.
Okay.
You did have a couple discrepancies with the 1 versus 2 points, and then you did have some difficulty with the soft.
Okay.
Okay, so I would say that there's definitely something going on with your sensory components. Now, I'm not sure if it is related or unrelated to the scalp. I would guess it probably is. So the last thing I'm going to test as far as your sensation is down your arm. So I'm going to test a couple dermatones here. So
Okay.
just have you rest like this for me. I want you to tell me whether or not it feels any different as I go through the different dermatones. Okay, so close your eyes for me. So basically, if I touch you here
Mm-hmm.
and here, does that feel about the same?
About the same, yeah.
About the same. Here and here,
About the same.
here, here,
About the same.
same. Here and here.
That's the same. The same.
Good.
Same.
If you can flip your hands for me. Any difference here versus here?
No.
Or here, here?
They're the same.
Same. Hands feel about the same?
Mm-hmm.
Okay, good. So if I can have you open your eyes for me, I'm going to have you look straight ahead and just kind of ignore what I'm doing. I'm going to have you hold your hands for me.
Mm-hmm.
Perfect. Very good. Okay, so same thing, just look straight ahead for me. I know that's a little, it makes you want to blink, but that's the point of the test, so you're doing really well. Good. If you can hang your jaw open just a little bit. Okay. So sensory components dermatomes in your upper extremities is normal. I would like to have you back for a more in-depth sensation exam because a lot of those tests you did fail, unfortunately. So I'm not quite sure at this time what could be causing it. I would think because the components in your arms were normal, it could be just some mild swelling that you have going on in your face and in your head, but I definitely think we should retest that, okay? So I will go ahead and make note of that.
Okay.
So facial sensation was slightly abnormal. Medial to your ears. It was bilateral on both sides. So I would say the good news is that the sensation wasn't different on one side to the other. It is a bilateral loss, which from my perspective is a good thing. So it means that there's not something going on one side of the brain versus the other. So something we can definitely look into a little bit further. Okay. Let's go ahead and move on. We're going to test a couple of your kind of strength and dexterity of your hands.
Okay.
So if I can have you hold your arms up like this for me. Can you not let me pull towards me? And then don't let me push. And then just with your wrist, don't let me pull back and push towards me. Good. You can uncross your legs for me. So I'd like you to push up towards me and down and up and down. And with your legs, pull back and push forward. Very good. Quick test of your reflex here. Very healthy reflexes there. So I'm going to have you just kind of rest your arm here.
Okay.
Any pain in that bone there?
No.
Okay, good. Just relax here for me. Good. And if you can hold your hand up just like this, and then just kind of relax your fingers. Perfect, okay. So same thing on this side. Love this tattoo, by the way.
Thank you.
Any pain there?
Mm-mm.
Good, okay. Let's just relax for me. Good, and then same thing. So fingers are nice and loose, no excess rigidity there, which is a good sign.
Mm-hmm.
So if I test you for bone conduction, I'm going to create a kind of like a vibration sensation.
Mm-hmm.
Do you feel that that's vibrating?
Yeah.
Okay, can you tell me when it stops?
No.
Good. Feel that there?
Yeah.
Do you feel
No.
it stop? Good. Okay. It's going to feel a little funny. You feel it here?
Yeah.
Okay. Feel it here?
Mm-hmm.
Good. Same thing, feel it here?
Mm-hmm.
Feel it stop?
Yeah.
Okay. Feel that there?
Barely.
Barely. Does it feel less than on that side?
About the same.
About the same. Same?
Yeah, no.
Barely feel it?
Mhm.
Okay. Okay, so that could be related to the sensory loss. Do you feel it here?
No.
No? Here?
No.
And here?
No.
Okay. So your vibration sense is also lacking just a little bit. So that's something that we would also need to test as far as your sensation. So bone conduction was normal in upper extremities and lower extremities, but abnormal in the cranium.
Mm-hmm.
All right, so we are moving right along. We are almost complete with your examination sheet. I'm just going to test one final thing.
Okay.
So because your sensation was abnormal, I'm just going to use this tool to test for any abnormal hot spots of the head. So I want to see if there's any swelling related to like thermal regulation. So this feels very cold to the touch, just to give you a warning. I'm just basically going to test. It will beep if there's any abnormal temperature regulation here. And no pain in these areas, correct?
Correct.
Okay, so far all of that looks okay. going to test the back of the neck there, so right at the top of that thoracic spine. Okay, so all of that is normal. So I am going to take a couple notes. There were a few things that I'm a little bit concerned about, specifically that sensory loss. So the rest of your cranial nerve exam was very well intact, so I would say you did fairly well. Just slightly concerned about the sensory component. So if you are comfortable, I would like to go ahead and get you scheduled for more of an in-depth examination. That way you can come in and I'll have a little more time to go through more of those dermatomes specifically. Other than that, I would say we are all done for the day, so you did really well. I'm going to go ahead and take a couple notes here. On your way out, when you go through the exit, the receptionist desk is there. If you could just stop by and talk to Lydia for me, she will have the notes ready, and then you can book your appointment with her. That way we can get you back in.
Okay, thank you.
Okay? All right. Well, thank you very much. Thank you for coming in. I hope you have a good day, and of course, prior to that examination, if you experience any difficulties, you can just give me a call and we'll have you back in.
Okay.
Okay?
Okay.
All right. Thank you. Have a good day.
Yeah, you too.